Thanks for being here. Um, Unfortunately, we lost 5 residents over the last 24 hours. Caucasian male 91, Caucasian female 80, African American male 74, Caucasian male 56. We lost 1 member in a nursing home over the last 24 hours. So overall, 584 residents of Onondaga County have passed related to COVID-19 since March 16th of 2020. Certainly, our thoughts and prayers are with all of these families overall, and certainly, again, as this process moves on, nobody's a stranger that dies. They're all part of our Onondaga County family, but it's amazing how this impacts you more and more every day as this pandemic continues to rage on in ways. Overall, cases are going in the right direction. So the positivity rate, 7-day average, is a 4.9%. Hospitalizations, we're at 171 in the hospital. We have 36 of our residents in the ICU. We have 7 residents out of the 171 who are waiting to be transferred to the COVID transitional unit as they wait to get a negative PCR test so they can return to their residence. So hospital numbers are good. We're on the lower end. We're stabilizing. It will continue to get better if we can continue to keep cases going in the right direction. When we look at cases, we have now had 28,458 positive cases. That's 205 new cases. So almost got there. We almost broke the 200 barrier today. Maybe tomorrow. We'll see what happens. But overall, I think we've now had 7 or 8 days in a row with cases in the 200s, whereas before we would have a case in the 200s, then 300s, then 400s, and back then. So things have certainly started to stabilize and go in the right direction. So I just want to thank the community for doing your part and stepping up and avoiding gatherings and wearing your masks and physically distancing, washing hands, everything that we've been saying for so long, but we have to continue to be very diligent with this as we vaccinate. Related to testing, again, symptomatic testing demand has dropped. I think now that we've seen cases drop, I think that's probably a positive sign. Before you worried that are people just getting tired and not going and getting tested, but it's been dropping for the last few weeks, and cases have been too. So, but needless to say, our best way to make sure that we don't have symptomatic spread is when you have symptoms is to stay home and get a test. We have the resources. Again, symptomatic testing during the week is at the FSHAD at the regional market, ongov.net/Cayuga Medical, 9 to 2. Appointments are pretty easy to get into these days. On weekends, it's at Nescentia Health on Saturday and Sundays from 8 a.m. to noon. Again, same link, ongov.net/Cayuga Medical. So please, 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 if you're sick, any symptoms, we need to rule out COVID. Right now, everybody's tired and everybody's getting a little frustrated with different parts of this pandemic, all of us included. But this is the one thing that we just got to get right. If we can keep this going right, we'll get through this much, much faster. Is if you're sick, we all know what the symptoms are, get a COVID test and rule it out and stay home. So please continue to do that, and we'll have success. Asymptomatic testing continues here at the On Center every day. Again, we've seen drops in demand in our asymptomatic testing as well. We still encourage that. It can't hurt. And this is how we continue to find hidden pockets of the virus. So for asymptomatic tested, covid19.ongov.net. Today we are at East Syracuse Village Hall. Tomorrow, the 26th, we are at Shove Park in Camillus and the Syracuse Northeast Community Center. On Wednesday, we will be at the Fayetteville Village Hall and the Town of Clay Senior Center. On Thursday, we will be at Onondaga Town Hall, and Friday, we will be at the Lafayette Community Center. Again, part of what we're doing is we're intentionally trying to test in various geographies throughout the county so that we can find pockets of this virus that really isn't showing symptoms. And we've had success. This has been something that we did, and we did a lot of after the holiday season, and we believe that has had a big impact. If you look to see where our data has gone, even though some of our other communities our size or bigger than us are starting to get better and turn the corner, we turned it much faster. Vaccine, we'll go over this. Don't have a ton of new information on the vaccine, but some new information. Today, I think the governor announced over the weekend, from an equity standpoint, trying to make sure that the vaccine is getting into every community in our county, specifically communities of color. And today, in partnership with New York State and the AME Zion Church, Pastor Darren Jaime, we've had a clinic at that facility. I was just over there. It was great. And we'll have 275 residents vaccinated in our south side. I want to thank our team, Ann Rooney, and all of our team who helped coordinate the outreach through credible messengers in the community. So various pastors, various community leaders reaching out to our seniors and making sure that they got there. This is important. These folks are now going to be their own credible messengers in the community, and for us to have herd immunity as a county, but specifically to make sure that these communities that in many ways have been disproportionately impacted by COVID, that there are credible messengers that can be out there outside of your normal advocates. So this was a good day related to that, and it was really nice to see. So I know it put a smile on our health department's faces every time we can vaccinate. That helps our health department's mental health. Looking at, again, where there's vaccine in the community. So each week it's tough at this point because when the vaccinations really started, the fairgrounds came online, and then the fairgrounds set appointments for weeks in advance. So the vaccine that comes into the community is supporting essentially existing appointments. So for those who want to get an appointment, they couldn't get one, and it wasn't easy to get when all these eligible 1A and 1B came online. We're talking about 100,000 people. All those people that didn't get one are frustrated because they want one, and we're frustrated too. So the existing allotments that are coming in this week, with the exception of the doses we get, are already to service existing appointments. So the fairgrounds will get vaccine. The pharmacies will get vaccine. Those are to really deal with existing appointments, though. The county looks like we're going to receive 1,000 doses of Moderna this week. That's up from 900 last week, so I want to thank New York for that. I appreciate that, but I'm about 9,000 short. What we'll do is tomorrow we physically should get the vaccine. Once we physically have it, I know it's safe to start looking at setting up a registration. So on Thursday, a registration link will open up. I'm saying that now. Today's Monday, so you guys will all report that. I will send out reminders on social media that Thursday there will be a link, but that is not how I am reporting there's a link. I'm reporting it to all of you today, and so please help us get the message out. we know there is a challenge with seniors registering online. We are very close with having essentially our own pilot on how we can do this better, because I don't know how, when we only have 1,000 doses, and out of those 1,000 doses, the state's telling me I have to do certain groups in addition to seniors, meaning I have to do some teachers, I have to do law enforcement, I have to do these other public service departments. I can't just do seniors. So out of 1,000, I have to do more than just seniors. I don't know the best way to do this when we have 70,000 people who qualify, when I have 1,000 to give, okay? So what we will do with our seniors most likely is we'll most likely have a link where we will do some sort of pre-registration. We will figure out of the pre-registration an equitable way at who will get slots. It may be some sort of lottery. We'll know that hopefully more tomorrow. Every time we try to do something, the technology needs to support what you're doing. And then we'll hopefully get our pharmacy partners to buy into this as a way, so when Kinney Drugs is opening up slots again, they don't go for a online registration process. They pull from our pre-registration process. I hope that's what this can look like. And hopefully we'll be able to have all the details tomorrow. And then it's a pilot. We're going to see if it works or not. What would work is if we had 50,000 people who wanted a shot and we had 50,000 doses of vaccine, we could just give 50,000 people a shot. But that's not where we are, and that's not where we're going to be for a while. So we'll try this out. We'll see if it works better. I want everybody to get a shot in the county, and I want it to happen yesterday. But that's just not where we are. So we just need to be patient with each other, and we'll grind through this. And in the meantime, we continue to do the things we need to do to stay safe. Going into today, we administered 13,980 doses out of our pod, so we'll get over 14,000. I think this week, when we look at everyone in Onondaga County, we'll probably be north of 10% of our population. It's difficult for me to confirm that at this point, because you have the fairground slots, you have the hospital slots that have happened, the pharmacy slots. We also have residents going out of the community to get shots. Some of our doses are for people from out of the community. So, but it looks like, based off of where we are at the end of this week, we'll have over 10% of our county will have received a first dose. So we're making progress. We are. It's just not as fast as we want it. Second doses, tomorrow we start doing second doses for, was it the 28th and 29th, Ann? The 28th and 29th of December. We'll be receiving the second doses tomorrow, and then the next day, I believe, is the 30th, and then the following day is the 31st. And again, we'll have our new clinic on Friday for first doses. So how do you know if you were one of the 13,980 that have received your first dose with us? When you get your second dose, you will have received an email from us. If you didn't give us an email, we'll call you, usually about a week before. Maybe it's 5 days before or 4 days before, but the email will come from COVID vaccinations, and then we will schedule the appointment for you through the email. Again, if you received Moderna, which with us you have, with the exception of 1 day so far, your second dose needs to be a Moderna, and we have your second dose. You don't come to our pod and then go to the fairgrounds, or you don't come to our pod and then say, I'm going to go to Plattsburgh or Potsdam or Marcy. Wherever you go for that first shot, that's where you're going for the second shot. And again, if you receive Moderna on your first shot, you need Moderna on your second shot. Just a reminder on case investigations, please continue to cooperate utilizing the text messaging that we send out, 833-634-1564. Again, if you're COVID positive, if you get that, that's us. Please feel free to fill out that information for us. That helps streamline our investigations. that when we're done with our investigation, we can turn it over to the contact tracers, and they can then do their work. So thank you for everybody who's really helped us through this. This has been a great tool. Again, I think shortly after the last time we were together, we talked about high school sports. Very happy with the state giving local health departments the discretion to work towards allowing a season for these kids. We're going to have a season. We're working with Section 3 right now on what some of their ideas were for the winter season. The winter season is different from the fall season. Most of your fall sports are outdoors, so different types of things there. We're working with our health department. We'll look at different guidances. We'll get ideas from the school districts and Section 3. We'll then come out with our guidance for Onondaga County, but there will be a winter sports season in Onondaga County. Saying that, happy to take questions.
This pilot program for seniors sounds like a big development. Would you just reiterate what your plan is and what seniors watching need to know?
Yeah, so what we're trying to do is pre-register seniors. And so the question is, how many can you pre-register? Does it make sense to pre-register? If you have 70,000 seniors, does it make sense to pre-register 70,000 seniors? Probably not. And then for us to have to be able to effectively then have some equitable way for those seniors that week to get appointments, and then they come off the list, and then the next week what seniors get, whether other states are doing like a lottery system. So if you have 10,000 individuals registered and you all get a number, 1 to 100, and then you have a lottery and your number 100 comes up, all the 100s get an appointment this week, then we could call them and tell them this is your appointment and this is where you're going. It will work better if the pharmacies who are getting new doses, when if they stopped the online registration and then it said, moving forward, we'll work with you out of your pre-registration system and we'll do the same thing, that would work well. We're not quite there yet, but we have to figure out a better way than the mad dash for people online, almost knocking down our IT infrastructure every time. And again, this is the best way right now. We've been taking 2-1-1 and saving slots there for seniors. And then we tell people when and they go on. But again, we're talking about 1,000 doses for what is probably 70,000 people at this point. So we got to figure out a better way to do this moving forward. So we're vetting it. The technology, it does. There's more to this than coming up with an idea and implementing it, unfortunately. But hopefully we'll be able to have this all worked out tomorrow so we can start that process.
Is the advantage of this almost a one-time registration, and then people know we'll wait to hear from you, we'll get in touch when it's your turn?
Correct. And so again, you can't, at some point you don't want that number too big, because if supply becomes very easy to get and we're getting a lot of supply, and then the fairgrounds has more supply and they can open up more appointments, you want people to go that way. But right now, out of the appointments that come available, there's so many seniors that just don't even ever get a chance at it. And so we're trying to level the playing field the best we can, knowing that in 2 weeks from now, if this happens and it goes off, you'll all be probably pointing out all the flaws in the new pilot and asking me how we're going to pivot and adapt. I understand that's going to happen the rest of the way here on this until we get enough vaccine to get everybody shots. And this is frustrating. This is very emotional for people, and it's very emotional for our staff who takes the calls all day, and people want to know why they're not getting a shot, and they're scared and they want their lives back, and we want to be able to get everybody a shot. We just don't have enough of them.
This will be for 65 plus?
Yes.
And you'll give them a window in which to pre-register. It won't have to be a mad dash, but
correct.
And you're expecting this Thursday?
We would like to have this up before Thursday so that people will have time, and then on our Friday allotment we could have some sort of system to pull from the pre-registration a certain number of the 1,000 slots. Again, we still have to get, the state has given us guidance that we still need to make sure the groups. The state is saying to some health departments and other parts of the state that you should just be focusing in on teachers and law enforcement and whatnot. What happened in our community is we got a head start, and we've actually gone through quite a bit of these professions already, and we have data to show us that. And the fairground site, the state sites were supposed to kind of lean more senior driven, and what happened was when the fairgrounds came online, it was a free-for-all. So a lot of people that the county pods were intentioned to vaccinate have already signed up at the fairgrounds. So who's been left behind? It's your seniors who don't have good technology skills. So we're trying to level that playing field.
Has Kinney agreed?
They have not agreed yet. We're trying to work through that. That's a key part. For it to work well, we need you know, I don't know how many weeks out they're booked right now. I know they're booked, but on that week they move to this system. If that partnership could happen, I think we'd see better results because we would get through that first pre-registration group faster.
Is the pilot program going to be heavily based online, or are seniors going to be able to call and get on this pre-registration?
You know, we're looking at that. Again, one of the advantages why we can do this, we have an adult and long-term care department where we work with seniors right now. So we would encourage online because it won't be a race, so it won't be as the pressure, but certainly we would look at helping to set up appointments. Could we set up thousands of appointments on pre-register or register thousands? Again, you're talking about a phone system, right? So there's going to be certain limitations to that as well, but we know we got to try to make this easier for these residents.
So it sounds like your goal this week is to try this on a small scale at Friday's clinic?
Yeah, we would like to have a certain number of slots Friday dedicated to this, and to see how it works and how we can build off of it.
And would the 211 system still be up and running?
It's up in the air, Terry, because
Okay.
even though it works well, but when you got 20,000 people calling and they're all gone, it creates the same anxiety and the same frustration levels.
What other pharmacies would need to be a part of it? Wegmans has a few.
Yeah, we would reach out to them. So the other pharmacies are, I think they only have a couple, right? Kinney's is the real partner that we know they're getting 1,600 a week. At some point that might be more, right? More supply comes in. So we'll start with Kinney, and then if the other, I think Tops has a couple, Wegmans has a couple, and I think there might be 2 independents as well.
So Kinney's make or break. The others are. You need Kinney to be a part of this for it to truly work.
Yeah,
The other
yeah,
ones
and
are small.
Kinney's a great partner, so I'm sure they'll give it a hard look. I know they will.
Are there any specifics you can mention when it comes to the conversation right now with the health department and Section 3 when it comes to this guidance? Any particular sport that sticks out to you as certain things they're working on?
Yeah, I think we just need to take a look at what they give us, look at best practices with some of the collegiate sports, and see what they're doing, where they've had success, and try to replicate it. And so I think obviously there are some sports during the competition they don't wear masks, and so if you're going to do that, do you have testing protocols similar to those sports, right? Easier to wear a mask in practice and whatnot. So those are some things we just got to work out. So we're waiting on Section 3 to show us what their thoughts are. Then we'll take a look at everything and try to, again, this is a very, very positive thing. We'll have a lot of positives for the students and parents, and help them get back some level of normalcy. At the same time, we have to make sure that we don't a event isn't a super spreader event. So this won't be a free-for-all.
Would you be open to the idea of there being different guidance for different sports? Like you said, if it's wrestling or one where we really can't cut that off.
Yeah.
Being more rigorous with testing for those athletes.
Yeah, if the data merits it, and then I think that's what they'll look at. So it's, again, the nice thing is we don't need to create the wheel here. The collegiate sports have kind of done a lot of this already. So looking at the data and then looking at we're testing in a lot of these buildings now each week. Could the school have their athletes be those who are getting tested? These are all things that we'll iron out throughout the week, and then we'll get something out so the season can start.
And this might not be a question you can answer now, like you just said, but with the counties kind of working each on their own, do you see there being kind of cross-county competition going on, or do you see it staying internal here in Onondaga?
Yeah, well, I think Section 3 overall is, I think, 11 counties. So you're going to need to have similar guidance, at least as it gets to, I would think, now testing in some of these counties might not have the infrastructure we have. It's very easy for us to have a testing component. We have so much of it. So we would have to look at that and look at the data and look at what the public health officials are comfortable with. But certainly it would work best for Section 3 if they had the same set of rules in every county. And so I think that's where they should try to get to.
Ryan, what's the timeline on that? When do you expect them, Section 3, to report back? Can practice start already?
No, so February 1 is when things can start. So this gives us really this week to work through what the guidance should look like, and then they might have some other certain number of practices before you can have a game too. But I think to get going on February 1, we have to have a couple of productive days here.
And what's the likelihood that fans or parents would be able to attend in person, especially at indoor arenas?
Yeah, I think, Terry, we got to work through that. I'm interested to see what their thoughts are. I know with the fall sports, I think you could have each athlete could have 2 family members there. Again, how do you, in each arena, how do you distance and how do you make that work? I think would be something that we have to take a look at.
Is your pilot program for seniors, is it simply a wait list, only it's not in any kind of order, it becomes a random release of 1,000 eligible this week?
Yeah, well, we're trying to figure out it is a pre-registration wait list, right, with a equitable potential lottery system that other states have done. But again, I mean, people are going to get mad about that when their number doesn't get picked, right? So best way to solve all this is to ramp up the supply, get that Johnson & Johnson vaccine approved. What we are getting a lot of is a call on a Tuesday. I didn't know about what happened on this day or that day, and I didn't see it. And so how do we do this in a way where it's equitable? And that's what we're struggling with. And it's going to be hard. We'll try something. We'll see how it works. If it doesn't work, we'll try it again. There's no pride in authorship here. We're just trying to meet an impossible task right now.
Ryan, this is probably an impossible question, but as you think about this pre-registration system, is there a way to register per household versus per person? Because there's a lot of elderly couples, and it would just be so much easier if they could go together.
Yeah. I think we're looking at that, Terry. I think that's what we've seen a lot of is even when seniors can't get the same appointments, they tend not to want to go unless they can. So addressing that's something we probably can address this way. Although if you do the lottery per household, you would have to. That would be a tweak, but that's something that you can maybe address this way.
Go ahead, Tommy. Go ahead.
Are any of our COVID testing labs equipped to detect the UK variant?
Well, we don't have any labs, so what it is we have the county doesn't own any labs. So I think the Cayuga Medical is our partner, both at the FSHED and at Essentia Health. So their labs use it. I do not know if they can look at the variants. The state lab at Wadsworth, I know, can. I don't know how many of our tests are going there still in the community. Our asymptomatic tests are rapid asymptomatic antigen tests here, so it's detecting for COVID load. So that may work, but it wouldn't. It will detect it. It won't tell me that this is a variant. So that's really something at the state level that it's probably very few actual labs that can do that. Erie County's lab may be able to do that with the right equipment. Wadsworth certainly can, but we don't. To my knowledge, our labs cannot.
Would you like to see some increased effort in that regard in the coming weeks?
Yeah, you know, until somebody can, for me personally, say that this variant, whatever variant it is, some suggest there's an American variant. And so until someone can say it gets you sicker, then I think it's kind of anxiety, right? So, and with the UK variant, they haven't said it makes you sicker. They said it might be more contagious. Okay, we know what to do to prevent COVID overall. It's the same stuff. So if somebody said that this new variant is here and it has these impacts, which are worse than what we've been dealing with, then I think that's a new ball game. But the science isn't there yet, to my knowledge.
Last week you mentioned that nursing home staff vaccination rates were not impressive, about half of them. We've gotten some anecdotal pushback of that, where some nursing homes are saying our staff's doing pretty good at this. Do you have updated numbers? Do you know which ones are problems? Is it still a general problem in your mind?
I don't have updated numbers, Andrew. My guess is that those numbers won't fluctuate much because it's a federal program. You get a first shot, a second shot, then they give you a third chance, right? So if you change your mind on second shot day, you get your first shot then, and there's a third day. So I don't think those percentages will probably increase or move much at all till that third shot wave happens. But it's, yeah, I mean, the data's the data, right? I mean, some are obviously, like everything, right? Some will do better than others, but I think it was in the 50% range, which there's a lot of room for improvement.
We get a lot of phone calls from seniors who don't really see the social media briefings or tweets or anything like that. They don't see what's really going on until the 5 o'clock news comes on. So is there a time frame for when these links go out? I know sometimes it's the morning, sometimes it's later in the afternoon.
Yeah, so let me go through, just because I was kind of annoyed with some of the feedback I've gotten related to the last week. So last week, we have a briefing on Tuesday. You all might have been here. You guys did a very good job covering what I said on Tuesday, Tuesday night, Wednesday morning, Wednesday at noon, in print, radio, television. What I did is I tweeted out a reminder that the link's going live in the afternoon. There was no news. I just used social media, and somehow many seniors, due to the way that was reported, the suggestion was to them, the way they read it, is that I only reported via Twitter that a registration link was going up Wednesday afternoon. So a registration link will go up Thursday afternoon. Today is Monday. So you guys did a great job reporting it before. I know you'll do a great job reporting it again. But I will, on Thursday, send out a tweet reminding people that the registration link is up, but I have told everybody Monday that it's going up on Thursday.
And you're talking about the 1,000 doses.
Correct.
That we're going to go through the old way, not necessarily the pre-registration.
So we'll talk more about the senior specific slots we'll reserve, but the same registration process for everybody else. Remember, I can't just say seniors are getting this. The state has told me that I can't do that. So the same registration process will be there for many members of the community. We're trying to focus something specifically as seniors as a pilot to see if it works. And then if it works, we move forward with it that way. And we'll talk more about that tomorrow when I know the technology can support what we're trying to accomplish.
You say you'll talk about that. Are you expecting to announce that on Facebook Live?
Yeah, we'll probably do a
what's the
Facebook.
rollout
We'll do a release and a Facebook Live rollout. Yeah.
And you hope to have it live then?
Yes. If we can roll it out as fast as we can, because then people can start pre-registering.
And you anticipate it? I mean, yes, you're working on some phone access and all those other things, but at the basis, it's a registration form online for people 65 and older.
Correct.
On another topic, the White Pine Commerce Park, do you support that being expanded?
Absolutely.
And what do you say to the people whose homes might be affected?
Well, I've met face-to-face with these folks. So the reality is the White Pine Business Park, which has been an industrial zone park for over 20 years, before many of these people lived in the neighborhood as well, is one of the best sites in North America for high-tech manufacturing. And it's not because it's in just Onondaga County. That's one of the reasons. But that's where your east and west and north and south of the electric utilities in the state of New York meet. So you have enough ability at that substation there to power essentially a large city at that one substation. So there has been no secret for a decade of marketing this for a high-tech end user. We've had multiple times over the years to put a different type of user on that site. But people who are very wise said, don't do that because you can land the big project there because of the infrastructure. So that's been our goal, and there's no secret with that. What has happened over the last 2 years is that the national and international markets have recognized the strengths of the site. We're a finalist last year for what would have been the largest project in the history of Onondaga County, and we learned a lot from that. Part of what we learned from that is that these types of companies won't just make one investment or two investments, they'll make 3 or 4. So they need the ability to grow. So after recognizing that, we've purchased a lot of land, being the county IDA, and there has been options on other land. An option gives you flexibility. That doesn't mean that you have to close on it. It means that if you need to, you can. So really, there's a handful of neighbors that we may or may not need their property. We don't know if we do. And what would determine that would be whether or not the project that we get means we need that land. And again, we wouldn't be talking about a warehouse distribution center here to go have conversations with neighbors asking to buy their homes. Our Amazon project, that type of project, we don't go asking people to buy their homes. This is a once-in-a-generation project that we almost had, that we believe there will be opportunities in the near future because of repatriating of manufacturing and the significance of the semiconductor space coming back into the country. So we believe that there will be an opportunity and that we are the site in New York State that can land it. So if we land it and they need so much land, then we do have to have conversations with the owners. When I met with the owners face-to-face in a meeting, I think at the end of last year, I told every one of them, I understand some of you are not happy, and I understand that this creates anxiety, but also if the time comes where I need to sit in your living room and ask to buy your property, and I tell you why, and I talk about the opportunity in front of us for the community at large and for your children or grandchildren, I think you will begrudgingly be okay with the conversation and we'll come to a deal. And there's a little bit of anxiety and unknown right now for some of these neighbors because I can't have that conversation with them right now, Andrew, because I don't have a project yet. And so strategically there's property there where it made sense for us to buy no matter what. We bought it. We have options on it. If you had a certain end user, then strategically it makes sense to try to buy more property. We're talking to those folks. Some folks say no. Some say, I don't want to, but if you pay me X, I'll do it. Some folks who are in certain newspaper articles have actually even told us a price. But we're not going to pay that price unless we have an end user. So this is a fluid position, fluid process. The fact that we're talking about having one of the top 10 semiconductor companies in the world being in our community, though, is a good one. It's a good problem to have.
Going back to the beginning of your conversation today with the vaccination site at the AME Zion Church, you mentioned the number 275. I just wanted to clarify, was that 275 75 residents on the south side vaccinated today.
Correct.
And is that a number you're hoping to reach? Do you have a certain goal in mind as for where you would like to see that number moving forward?
That number there today was specifically because of supply. So if the state had appropriated 500 vaccines to us, we would have done 500. Demand wasn't the issue today. We could have did more.
Do you know how that's going to work going forward? I understand the governor's emphasis on trying to get the vaccine into communities like at the AME Zion Church, but it also seems like those appointments were made a little bit behind closed doors. You know, you had to know somebody in a good way, but to get in.
Mm-hmm.
But do you think, like, how do you see that going forward?
Yeah, I think going forward it will probably be more surgical, going to public housing and doing appointments there at Syracuse Housing Authority and whatnot. So there's not a registration process per se. You know who your end user is, the folks who live in the building, so you go through and you do your education days in advance, and then you go that way. We're ready to do that. We've been ready to do that. We just need the vaccine. So hopefully they'll give us some, and that's the next way to do it. To your point, we didn't really, various parishes or various churches got various slots, and then we helped get everything registered on our side and whatnot. It wasn't your formal process. So I think moving forward on the equity standpoint, that's what it will be like. Independent living facilities for seniors, same thing. We'd like to come to you when we can, when we have the supply. That's our commitment, but we just not there. So I think that's how that will play moving forward, I would think, Terry. Maybe there's times where it goes back to today's model, but for us, today's model wasn't the most efficient model either.
The governor today in his briefing mentioned the altering of zones possibly,
Yeah.
based on new data. Any insight on to if that is our zone and what the change might be?
Yeah, I think our data kind of speaks for itself where we're going, and if we keep going this way, I think even by the old standards, we could work our way out of some of these zones. But I think there's an acknowledgement that what was driving, unlike Rockland and Orange and Brooklyn when the clusters were created, what drove that was behavior, right? What drove our upticks was behavior based off of a calendar. And then that behavior based off of calendars walked us into the winter, where it's peak time for COVID anyways. So I think there's an acknowledgement now coming back that the economic restrictions probably had very little impact to slow it down in Onondaga County, because I think the one that really works, and which is still probably going to be considered, is the timing, right? At some point in hospitality, once you get past 10 o'clock, 11 o'clock, people are no longer eating at establishments. So I think that's the one regulation that probably helped during the zones. The other ones, we kind of got into a calendar of social behavior that it took a while for the community to wake up to. But I think people woke up after what they saw happen in Thanksgiving. We did not see a Christmas surge, and we certainly didn't see a New Year's surge.
I do eat after midnight, just so you know.
Well, some of us do. Some of us don't, right? So, other questions? We good? All right, thanks, folks. So on our to-do list is trying to put more meat behind the bones on the pre-registration initiative with our seniors, and we'll hopefully have that out to you tomorrow. But we will do this again on Thursday. Okay? Thank you.